am Dr. Pavan Pai. I am practicing as consultant neurologist and neurointerventionist at Wockhardt Hospital, Mira Road.
Hi, I am Dr. Ashwin Borkar. I am consultant neurosurgeon at Wockhardt Hospital, Mira Road.
Dr. Prajapati, who is practicing as a physician in Bhayandar area, 32-year-old male, had come to us on 15 July with onset of right-sided weakness since 10:30 am on that day. He had done an MRI outside which had shown that there was a large left side MCA-PCA territory infarct. And when he came to us at 1:30, when we saw him, his right side was completely weak. He was not able to move his legs and hand, and he was not able to speak. So we immediately started him on IV thrombolysis from 1:40 p.m. onwards, and we did his CT angiography of the brain, which showed us that his artery supply to the left side of the brain was completely occluded by a clot. So in these situations, we advise the patient to undergo a mechanical thrombectomy, in which we remove the clot using a stent retriever device, which results in complete recanalization, that is recurrence of flow into the artery, and which can result in improvement of the weakness because of the infarct over a period of say 3 months, sometimes earlier than that. So this patient agreed, and we did his mechanical thrombectomy, and the procedure was successful. In one attempt, the artery opened up completely, restoring the blood supply, and we also did a CT scan after the procedure, which showed that there was good recanalization. Next day we did an MRI, which showed that we could save at least 60 to 65% of his brain by doing this procedure. So eventually the patient was on the slight verge of recovery, in which he was able to move his right leg and was able to open his eyes from next day onwards. But eventually, over a period of 2 days, on third day, he became a bit drowsy, and that's why we repeated a CT scan on the Saturday, that is 18 July, and we found that the original infarct had itself swollen, and then that was compressing the normal brain structure, because of which he had become drowsy. So we immediately took support of Dr. Ashwin Borkar, who is a neurosurgeon.
Yeah, the CT showed that there was indeed a good amount of pressure on the brain, and it was actually, the thing is, this thing is quite common with such type of large strokes. When you open up an artery, there is edema, and in the first 4 days it is very much expected, but it goes on increasing, because you need to realize that the brain is enclosed in a closed structure, and the pressure goes on building, and patient might deteriorate very suddenly. So life-saving surgery, which is called as a decompressive craniectomy, was planned as an emergency surgery. And I just want to show a small, it's like we remove this flap, a bone flap, because brain is inside enclosed structure here, and the pressure increases. So what we do is, we just remove this flap. It just acts, it gives space for the brain to expand, and without compressing the internal brain structures, which is the brainstem. And this is a life-saving surgery. So with this, when this surgery was done, and with some mechanical ventilation, we could actually control the edema or the pressure that was increasing, and slowly he was weaned out of the ventilator, and then he showed signs of recovery. I just want to make it a point that such things are common with a stroke, which involves a large territory of the brain, and the edema is common. And this surgery, because he was young, 31 years, and this surgery is life-saving as well as limb-saving. Both a combination of mechanical thrombectomy and with a decompressive surgeries can give good results. That is what the point we want to make.
Patient currently, after undergoing tracheostomy on 22nd, he was weaned off from the ventilator. On 24th, he was made to sit on chair, and he was able to walk with support of 2 people. So basically, in large vessel occlusions, which cause acute ischemic strokes, there is a window period of 6 hours wherein we can do mechanical thrombectomy and remove the clot, and then once the clot is removed, then there is a possibility of recovery over a period of 3 months. It can be gradual, but then there has to be a lot of other supportive measures like physiotherapy and rehabilitation, which is needed along with the surgical and endovascular procedures. So mechanical thrombectomy followed by early decompression can help in not only saving lives but also in achieving a very good clinical outcome over a period of 3 months. So in this particular case, saving life was of course our primary goal, but what was more important than that was that
Quality of life.
Quality of life is important, and we wanted the patient to be on his feet, do his activities independently, and also since he is a doctor, we wanted him to resume his practice as soon as possible, and also be helpful to the society through him. So that is the main idea behind it.
Hello, myself Dr. Ajay Prajapati. I am brother of Dr. Vijay Shankar Prajapati. On 15 July, my brother was sudden fall down and he became semi-unconscious. After that, we reached the hospitals. From that hospitals, we sent it for MRI and CT scan. In MRI CT scan, we found my brother was suffering from brain stroke and hemorrhage in the brain. After that, from that hospital, we sent it in the Wockhardt Hospital in the under Dr. Pavan Pai. हॉस्पिटल पहुंचने के पहले ही डॉक्टर पवन पई से हमारी फ़ोन पे कांटेक्ट हो गया और पहुंचने के पहले वो अपने टीम के साथ यहाँ रेडी थे। पहुंचते ही उन्होंने सारे इमरजेंसी के ट्रीटमेंट चालू किए और हमें आगे के ट्रीटमेंट्स के सर्जरी के लिए उन्होंने हमें अपने प्लान्स बताए। उन्होंने अपने सारे काम एक्टिवली एंड एफर्टली काफ़ी अच्छे से किए। उन्होंने हमें कहा कि हम अपने पेशेंट को यहाँ से बाय वॉक भेजना चाहते हैं, बिकॉज माई ब्रदर वॉज ऑल्सो पैरालाइज फ्रॉम राइट साइडेड। सर ने अपने बोले हिसाब से हमारे भाई को 10 से 11वें दिन में उन्होंने चलाना भी शुरू कर दिया। इसके साथ साथ सर ने हमें काफ़ी सपोर्ट किए। यहाँ पे सर के सपोर्ट के साथ साथ यहाँ के आईसीयू के डॉक्टर्स, यहाँ के वार्ड्स के डॉक्टर और सिस्टर्स वगैरह भी हमें काफ़ी यहाँ पे हेल्पफुल किए। इन कोरोना के पीरियड में भी हमें यहाँ पे काफ़ी सेपरेशन मिला, काफ़ी सेफ्टी का भी ध्यान रखा गया। इस फैसिलिटी के साथ हम काफ़ी यहाँ से सेटिस्फाई हैं।